Hello. Please hit like button and subscribe my channel. Also press bell icon for future video notifications. Thanks.
Degenerative disc disease affects about 40% of people aged 40, increasing to about 80% among those aged 80 or older. The disease, which is the deterioration of one or more intervertebral discs of the spine, often is surgically treated with cervical disc implants. In order to determine if a patient is a candidate for a cervical disc implant, surgeons have to rely primarily on the findings of diagnostic imaging studies, without any input from biomechanical data to optimize the type of prosthesis. This may occasionally lead to complications and implant failure. To address these problems, Florida Atlantic University's Eric Engeberg, Ph.D., senior author of the study, and researchers from the College of Engineering and Computer Science, in collaboration with Frank Vrianis, M.D., senior author of the study and director of the Marcus Neuroscience Institute. The researchers have developed a 3D printed spine replica modified to include an artificial disc implant and outfitted with a soft magnetic sensor array. A robotic arm flexed and extended the cervical spine replica while the intervertebral loads were monitored with the soft magnetic sensor array to classify the spine posture with 4 different machine learning algorithms. Researchers then compared the capabilities of the algorithms to classify 5 different postures of the human spine robotic replica: center, mid-flexion, flexion, mid-extension and extension. Results of the study, published in the journal Sensors, showed that the soft magnetic sensor array system had the high capability to classify the 5 different postures of the spine with 100% accuracy, which can be a predictor of different problems of the spine that people experience. These results indicate that the integration of the soft magnetic sensor array within the artificial disc, implanted, robotically actuated spine replica has the potential to generate physiologically relevant data before invasive surgeries, which could be used preoperatively to assess the suitability. These sensors are low-cost, highly sensitive, and easily integrated into robotic systems as the soft medium can be manipulated in many shapes and sizes. In addition to preoperatively assessing the suitability of a particular intervention for specific patients, this new approach could potentially. Questions regarding how much bending, lifting, and exercising is permissible after a cervical implant operation could be studied and correlated with biomechanical data generated by the sensorized robotic replica with individually tailored postoperative care that could be prescribed to reduce complications. This new approach has a powerful potential to enable surgeons to preview and compare the effects of different surgical interventions in a patient-specific manner using robotically actuated spine twins, said Vrianis. Moreover, the novel system could help in determining whether a constrained, semi-constrained, or unconstrained device could be the best fit or even a fusion device. Following surgery, the spine replica could also assist us in estimating whether there is sufficient motion at the operated level and possibly helping us to determine if we need to change the rehabilitation program to prevent calcification and subsequent loss of intended motion. In the future, our new approach could provide surgeons with first-hand data to compare the effects of different surgical interventions to treat diseases of the spine before surgery and potentially reduce the rates of complication and failure of artificial disc implantation, said study co-author Kai-Tae Tsai, Ph. Study co-authors are Maohua Lin, Ph.D., research scientist, and Moed A. Abed, a Ph.D. student and research assistant, FAU's Department of Ocean and Mechanical Engineering, and Alex Tang, an undergraduate student at the University of Virginia. Sensors, 2021. 221, 212 doi. 10. 3390 per second 22010212 Florida Atlantic University. 3D robotic spine, twin and sensor offer new way to preview surgical interventions. Science Daily. https://ift. TT 3FDJA6X. Accessed January 19, 2022. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.